the most common things we see with that is, we see obstructions. For whatever reason, this is just maybe me anecdotally, I see it way more commonly in large breed dogs than I do in small breeds. So, most large breeds are like me. They eat everything all the time, anytime. So, anytime I've got a large breed dog, especially if they're relatively young in that, 2 to 10 years of age window, all of a sudden changes where they're dumpy and they're not eating for no reason. Certainly there's usually some vomiting involved in that. Those are hallmarks of obstruction. Of course, profuse vomiting. If I have a dog who's eating, not all of a sudden not eating, they're vomiting 5-10 times or more a day. That's certainly a thing. But definitely a lot of times they can be nuanced, because a lot of times obstructions, they're not always just stuck. They'll oftentimes be moving, and so as they're moving, they oftentimes won't have as many symptoms as far as like vomiting and that sort of thing. But they won't usually eat, and they usually feel that crampy, lethargic. So. And again, sometimes they'll pass, sometimes they won't. So I definitely look for not eating, sudden changes in behavior, and then of course if it goes on for more than a day. Of course, if you get into like intractable pain, the dog's crying out, laying on their side, that's a definitely get them in right now because there's something major going on. So not exclusively, but I do tend to find that most obstructive cases we don't see diarrhea. That doesn't mean it's always the case, but so. I worry less if a dog's doing relatively okay, but they're having lots of diarrhea. I don't rule out an obstruction, but it makes me less likely of an issue. So.